Let's move on to the legislative recap and talk about what happened at the Capitol this session with regard to disability issues. And we are going to start off with a speaker from Texas Advocates. And Texas Advocates is the largest statewide self-advocacy organization in Texas and recognized as the leader in self-advocacy for Texans with IDD. Our speaker today from Texas Advocates is Brooke Hofeld, and Brooke is the co-executive director of Texas Advocates, and she's a 2008 graduate of Eastern New Mexico University in Roswell, where she holds certificates in childcare and office skills. Brooke spends her days running Texas Advocates Leadership Project, planning the annual conference, doing legislative activities, as well as overseeing the day-to-day operations of the organization. And when Brooke is not busy at work, she's likely volunteering in her church or home with her two cats. So, Brooke, if you want to come off or turn your camera on and take it away.
I was on mute. Hi, guys. So, as Scott said, my name is Brooke Hofeld, and I'm co-executive director of Texas Advocates. So today I'm just going to tell you about three bills that Texas Advocates was involved in this session. The first one, as you can see on your screen, is the Building Better Futures program. It established a Building Better Futures program within Texas Higher Education Coordinating Board. This creates a grant program from colleges and universities to expand inclusive post-secondary education programs for students with IDD, employment opportunities for individuals who attend these are proven to increase. So as you can see on your screen, building or HB 2081 establishes the Building Better Futures program. So I went to college in 2008, or actually in 2006, graduated in 2008. And I actually had to go away to New Mexico. There were very few programs out there for people like me or families like mine who had a child with a disability. Most of them either didn't go to college or had to go very far away out of state. So at the time that I went away to school, like I said, there were very few programs. There are currently only four programs, comprehensive transition programs in Texas. There are, for example, Florida has 32. So you can see the wide variety of the wide difference between a state like Florida and a state like Texas. And what they have to offer into post-secondary education for people with disabilities. This program will have a huge return on investment because students will, instead of going away to school and maybe getting a job in another state and then paying taxes to that state, Texas will get that investment. And Texas was lucky that I came back, but I know that there are instances where the person goes away to school and may not come back, and then that's a huge loss for Texas. Data shows that individuals who attend these programs have a lot more chances of getting a good paying job and then being able to contribute to their society, pay taxes, and just be a better contributing member to society. We can go ahead and go to the next slide. The next bill is HB 1188. And this bill is important to me because my family did not find out about really the LIDA or the services that the LIDA could provide until I was an adult. I believe I was 25 when we finally got on the waiting list for HCS. So this will allow families to be connected at a much younger age, pretty much as soon as their loved one is diagnosed or qualifies for special education based on an intellectual disability or a developmental disability. They will have to be given information about services and options. Unfortunately, my family was not given that information from a young age, and I likely missed out on some services that I could have gotten at a younger age. So that one is just going to be just really cool to see families find out younger, and then to see children and young adults get HCS at a lot younger age. And then as they progress through adulthood with the right services and supports, wouldn't be surprised if more people get jobs because they're getting better services at a younger age than waiting till they're halfway through adulthood before they get their services. And then the last thing is less than 1,000 slots were given out this session across all waivers, minus Star Plus. And like I said, the number is a little bit fuzzy. It's hard to understand. We've currently got 170,000 plus people waiting for services. And the picture is my friends Adam and Emma. They live here in Austin, and they moved here last summer, and we're just in a really bad crisis. And Emma actually had to apply for a crisis diversion slot and got it. And without the slot, they likely would have ended up in a situation that is less than ideal. But because of HCS and because of the services and supports that they can receive in their home, they are able to live in the community and have a very full adult life with friends, and just being able to just enjoy life together. So that is a huge win. And we can go to the next slide. Okay, so now we just wanted to highlight on the power of storytelling. So as you can tell, the Building Better Futures bill and the Caitlin Hanley Act were driven by self-advocates. For Building Better Futures, we had self-advocates come to Austin on a number of occasions in both the House and the Senate to testify on their bill. So it was driven by self-advocates, and we are more than confident that that is what carried the bill across the finish line this session, because self-advocates were able to come in, share their stories, and get the bill to the finish line. So we worked very closely with the architects on Building Better Futures, and it was actually at a hearing, a very late night hearing for school vouchers, that me and Sabrina stayed at the Capitol till about 3:30 in the morning waiting to testify. And it was through those conversations that she was able to better explain to me what building better futures was. And likely, had we not already had that partnership and we're partnered together, I probably wouldn't have learned about building better futures when I did, and then probably wouldn't have got to testify on it. We share this slide just to say that Texas Advocates is.
Brooke, you went on mute.
Sorry, I hit it with my hands. We share this slide just to share that Texas Advocates is ready. We have about 500 members across the state who are ready to share their stories. We hope that in the next session and in the interim that we can partner with more organizations like yours to help bring more bills to the finish line in the next session, excuse me. So that was all.
Awesome. Thank you, Brooke.
You're welcome.
Good start. Good start. All right, we are moving right along to our next participating organization, and that is going to be Texas Parent to Parent. And Texas Parent to Parent is committed to improving the lives of Texas children and adults with disabilities, chronic and mental health conditions, and other healthcare needs. We have two speakers from Texas Parent to Parent today. First off, we've got Amy Litzinger, who is the policy lead, which is of Texas Parent to Parent, which is cross disability and serves all ages. She helps self-advocates learn how to navigate their services and speak up for others to make improvements to the service system around them. We also have Linda Litzinger, who is the advocacy director at Texas Parent to Parent, and she also helps people to meet state agency or legislative staff to address needs, and she finds experts for her year-round Monday night Zooms on key issues. And they are both involved in state agency committees, helping people access the educational systems, both K-12 and higher ed. So thank you, Amy and Linda, and y'all take it away.
Thank you. I'm Linda Litzinger, and I'm very pleased to be here today. And our first bill is by Mary Gonzalez and Senator Brian Hughes. And I would like to say that it passed on the first try, but I think this was the fourth try. And I think many of us know that the deaf-blind, multi-handicapped uh, with disabilities waiver is about 20 years old. And for that waiver, you need to be deaf and blind and have a third disability. And for the group that is only deaf and blind, you would think that that ought to be enough to just hand somebody the world. But this bill has not made it for 4 sessions. And so this is the bill that keeps me awake at night, not understanding how this could be. And so if anybody would like to help with this bill next session, everybody would love the help. And what it does is, if you are deaf and blind, you don't know what's going on around you. It's very hard to get through your day at home, and it's really hard to get through your day going out into the community. Simple things like purchasing things or going to your bank. So a co-navigator does not really train you like an intervener does. An intervener in the deaf-blind waiver is also helping you to learn, but a co-navigator doesn't have to have the same skills, They just have to help you get through what you need to get through that day, because you've had some sight and sound in many cases earlier in your life. So anyway, we are very happy to continue working on it in future years. Thank you. Next slide, please. And this is Miss Amy's. Scott, do you know that Amy and I are not appearing on the screen?
We are at the top.
Oh, okay.
Hi, this is Amy Litzinger, and we are going to talk about HB 1941. This was by Representative Liz Campos, and it relates to adding peer support specialists for people with IDD, for those of us under Medicaid. And I spoke for this bill. Mental health peer supports are currently billable under Medicaid, but this would allow the same for IDD peer supports, and TCDD has funded projects that demonstrated the benefits. Some ideas that I had in my testimony is that peer supports are more available than formal supports, or access to family and friends for adults with IDD. And I also mentioned that there are some experiences that can only be really understood by a peer, like trying to find an attendant for a low wage, or finding a doctor, or navigating your community with a service dog. And I also talked about there might be some value to the experience of people that know how it is to have lived experience with co-occurring mental health and IDD, where you might need specific peer support for that. So I'm hoping that hearing that made a difference to some people, and we can get it passed the next time around.
Next slide, please. Oh, it's here. Sorry, guys. Cortical vision impairment screenings. This bill was by Mary Gonzalez and Senator Molly Cook, and it relates to screening for children who have not been diagnosed for their visual impairments. And we have national data that 1 in 30 kids in the US have cortical vision impairments, and only 20% of children are diagnosed. 4/5 of them are legally blind, and their schools are not helping them. This is a different kind of vision impairment that you cannot find with your standard eye exam. It is a neurological assault that happens in the pathway from your brain to your eyes. There are actually some conditions that would cause you to want to automatically check. They are traumatic brain injury, CMV virus. There's 10 of them, and there are many signs that children have that would show you that. So that means in our state of 31 million, that there would be very many undiagnosed kids if we're only finding nationally 6 out of 30. And that means the IEP might even be asking for the wrong things. For example, the mom who filed this bill is Mara Laviola. We have parents come to us and say, I'm really concerned about this issue. I'd like to file a bill. And then we help them file it and get through the process. And her son had things in his IEP about you will do it faster over time, this and that, but he couldn't even see. And so that was an incorrect IEP goal. So anyway, we hope that we get a lot more traction next year on this bill and that we actually get a hearing. Next slide, please. Amy, are you doing that one?
I thought that was you.
Oh, okay. I'd be happy to. Okay. Senate Bill 769 is what Senators Efrini had a bill 2 years ago, and it asked colleges to check on students with autism and write a report about how many are entering with autism, how many are graduating, what services are being provided. And this bill expands that idea to look at enrollment and success for all the rest of the disabilities, including autism, for students in college with disabilities. And it has the same typical schedule as the one we've been doing for autism, in that the bill report will be due in 2 years on 9/1 of 27. Thank you.
All right. Thank you, Amy and Linda, for that. We are going to move to our next organization, and that is the Autism Society of Texas, which is the state affiliate of the Autism Society of America. And they work to support individuals with autism in Texas through free information and referrals, education, support and enrichment groups, and state and national advocacy. Speaking for the Autism Society today will be Jackie Benestante, who is the executive director of the organization. She's passionate about advocating for people with disabilities and supporting families and autistic adults through programs and support at the Autism Society. She completed the Texas Partners in Policymaking program in 2019, serves on the Autism Society of America's Public Policy and Advocacy Committee, and hosts the Texas Autism Advocacy Day. Thank you, Jackie.
Great. Thanks, Scott. Thanks to all of you for coordinating this as well. All right, the first two bills, I'm going to just talk a little bit about these two, which both passed. HB2, Marissa is also going to talk about more of that later. There were many, many provisions in HB2. HB2 was a comprehensive public education bill that incorporated all the provisions from SB 568. And 568 focused on special education finance and policy reform. And notably, HB2 updates the special education funding formula for the first time in 30 years. So that was a huge deal. It replaces the previous system with a new intensity-based model that features service tiers, and it better aligns funding with the level of student need, regardless of where they're actually receiving their special education services. And the thing that I'm going to talk about today was actually something I worked on and our organization worked on extensively, and that was about crisis prevention and restraint. And so there was some important policy updates in HB2 related to that. And that is TEA rule. Well, first of all, TEA is now required to establish some rules. There'll be some rulemaking hearings, probably, I don't know when they'll be, sometime in the near future, I assume. But they will have to create requirements for school personnel training and crisis prevention and intervention. They'll also have to be training standards that use evidence-based practices aimed at preventing or reducing crises, including restraints. And then also targeted training. So staff training will be based on their likelihood of involvement in crisis situations. We actually did want everyone to be trained, but I think that just is cost prohibitive. And then there's also going to be new restraint and timeout procedures. So the commission is tasked with defining standards for safe use of restraint and timeout. Throughout 2024, a lot of disability orgs, including CTD, the ARC, US, Autism Society, DRTX, and some teacher organizations work together on discussing crisis prevention, discussing how, what's going on in schools, And so during that rulemaking, we'll definitely be very involved to make sure, like, really, you know, we're using good programs, evidence-based, making sure teachers and staff understand how to be proactive, set kids up for success rather than, waiting till they melt down and have it turns into a crisis. So we're really hoping to improve that situation. So that was all for HB2 and 568, but that was great that those passed. And then let's see. Is everybody muted too? I am hearing a little bit of background. I don't know if anyone else is, but it's not my, hopefully it's okay. And then our next bill, this is HB 2292 by Representative Alma Allen. And this is something that impacts kids with autism a lot, but it's about really all kids with disabilities. This bill has been introduced in 4 separate legislative sessions now, so 8 years. In the 88th session, it did pass out of committee, but this year in the 89th session, it did not even get a committee hearing, so it just went nowhere. It was originally introduced by Coalition of Texans with Disabilities, and it prohibits schools from calling parents to pick up children due to behavior or discipline issues. It affects students with autism a lot. It's kind of a form of shadow discipline. And repeated early dismissal should trigger a change of placement. If this is happening to you, parents do have the right to request a behavioral evaluation or behavior intervention plan, and we would really recommend getting one, because they should not be calling parents to have them come pick up their kids. And as you know, if you have a kiddo with autism, it's reinforcing that they get to go home. So it's a double whammy. And that is it. So I'm sure we'll keep working on that next session. That'll be 10 years. And then now we're going to move on. We worked on a lot of cross-disability legislation, but I am going to talk about specifically some ABA and autism benefits today. Some good news that we have, you can see the little check by it. The Medicaid ABA therapy became a Medicaid benefit February 1st, 2022. And it's been pretty challenging. The reimbursement rates were lower than, were pretty low. And compared to other states, we were also low in our Medicaid rate reimbursement. And it's kind of caused providers not to want to provide ABA therapy. And, we know that we've had everyone be successful in learning job skills. We've got autistic adults working in ABA for independent living skills. It helps with communication, your social ability, and, just so many, it's a way to, teach so many skills and break it down. And the rate increase just was for one billing code, which is 97153. And that's for registered behavior technicians who work under the supervision of a board certified behavior analysis. And the rate increase went from $13 to $13 per 15-minute unit to $14.50 per 15-minute unit. And that was in Rider 139. So this was a budget issue and not a bill. But we are excited to see that. Even a small increase is a win, as many of you know. And then under autism bills, these just did not go well. As you can see, the 3 red X's, 564 and 563, HB 564 and the companion bill SB 563 didn't get a hearing in committee. They're also similar to 813, the following one, but the 2 bills, 564 and 563, remove a requirement to have a diagnosis by age 10. There's a lot of outdated things in Texas insurance mandates regarding autism. There used to be an age cap on therapy. Some of this language is still in some of these bills. But health plans have to cover medically necessary autism treatment from the date of diagnosis, regardless of the child's age at diagnosis. HB 564 and SB 563 also defined what medically necessary treatment is. It would expand the definition of recognized services. And reinforce that autism services should include ABA, speech, occupational and physical therapy, behavioral interventions, and evaluations and assessments. It would also protect service delivery across different settings, including so insurance companies can't restrict where you're receiving the services. And that includes whether it's school or clinic or home. And this is unless Medicaid services apply there, like there's special Medicaid rules there. And then HB 813, which was similar, had some of the same things there was to bring the Texas autism insurance mandate into compliance with federal mental health parity laws. And that would remove the outdated and discriminatory restrictions, such as requiring an autism diagnosis before age 10 to qualify for therapy coverage, and capping therapy benefits at $36,000 a year. Both of those really related to applied behavior analysis, and both of those provisions violate federal mental health parity. So that was HB 813. It did get out of the House Committee on Insurance, but it didn't reach the House floor before the May 15th deadline. And then let's see. We then have Senate Bill 1678 by Jose Menendez. This did not get a hearing. It didn't even get a committee hearing. And this bill would have required health insurance plans to consider a coverage for a broader range of treatments, and notably expanding access to developmental relationship-based interventions and therapies. And then that's it for that slide. And then this bill, HB 2929, was voted out of the House Committee on Homeland Security, but then did not make it to the full House for a vote, and so it died. But it would require the Texas Commission on Law Enforcement to develop and maintain a mandatory training program for peace officers on how to effectively interact with individuals with autism spectrum disorder. And the training would be required to be 2 hours long and evidence-based. So it would cover understanding autism, manifestations, communication strategies, de-escalation techniques, locating vulnerable individuals, recognizing potential abuse or exploitation, and ensuring safety in correctional settings, and legal procedures for custody and emergency detention. So it did cover a lot of good things. There was some bill language that us and some other disability organizations are hoping to tweak if it's refiled next session. But overall, Autism Society is a huge supporter of increased law enforcement training that is mandatory. And then other things we worked on a lot this session that people will talk about later was opposing vouchers, removing harmful disciplinary requirements in HB 6. We supported the Building Better Futures Act and the Caitlin Hanley Act. So we were really glad to see those bills pass as well. And then that's all for us. Thanks.
Awesome. Thank you, Jackie. So I'm actually before we move on to our next group, I'm going to bounce back a few slides because I think I skipped over one did I delete it? Okay.
You just showed it a second
Here it
ago.
is. There it is. Yeah, here we go. So Linda, sending it back to you. Sorry for skipping over
Okay,
that
thank
slide.
you. And
Right.
Amy, jump in whenever you'd like to. This is a bill where in college, students burn popcorn just about every night in some dorm or another. So when Amy was in college, about every 3 nights there was a fire alarm in the middle of the night, and it was eventually cleared. But the students in high-rise dorms don't know what's real and what's not, and they expect to be evacuated in case it is real. And it often is because students start fires. So that's the bill. I think maybe many of us have seen in airports a fire evacuation chair that hangs on the wall in a suitcase, and you open the suitcase and unfold it just like a folding chair. And it's got a tractor tread on the bottom. And so one person can drive it out of the building. It can be driven, it's electric, driven down steps or up steps from a basement. And it's a real nifty thing. It doesn't cost hardly anything compared to the AED devices hanging on walls. So, there are colleges in Texas that have bought 150 of them for their 2 or 3 dozen students in wheelchairs, and they hang them on upper floors where needed. And but there are other universities in Texas that haven't bought a single one, and they also have 3 dozen students. So we are hoping this bill gets a hearing next time. And Amy, do you want to talk about the amount of times you've been in a practice for a wheelchair evacuation?
Yes. in a lot of cases, especially when I was in public school, everyone else would have an emergency drill, and they would say to me, "Oh, just wait in the hallway for the fire people to come get you," or "Don't worry about it. It's too complicated to practice with you." And even though I was fully included throughout my education, they would actively stop people who knew me well, and in some cases knew first aid that was specific to people with disabilities because they were in my Girl Scout troop, from trying to help me in a drill or a real emergency. So instead of having practiced what I needed to do, they were actively discouraging people. And we only had one drill my junior year because my school won a very old-fashioned now rescue chair. And when I heard about it, I insisted on having a drill, but they only agreed to having a drill with staff and the 4 students who used chairs after school, with no real testing of what it would be like if something happened during the school day.
Thank you. So, that didn't get into the IEPs this year, that an individual plan would go into each IEP, but we're working on it. We hope that we get it solved for college and high school. Thank you.
All right. Thank you, Amy and Linda. All right, let's move on back to our next group. I just want to say that we have been trying to get through the questions that have been posted in the Q&A. So if you have any of those, please put them in there. The slide's a little messed up. Sorry about that. So our next organization will be the Coalition of Texans with Disabilities. And founded in 1978, CTD is the largest and oldest member-driven cross-disability organization in the state. And cross-disability refers to all types of disabilities and different functional needs, rather than a particular disability or subset of disabilities. So we have 2 speakers from CTD today, and the first is Yulisa Chavez, and she is a fellow at CTD. As a former teacher and political scientist, Yulisa is interested in analyzing policy regarding elections, education, and economic development with the intersectionality of income, race, and gender. And in her spare time, Yulisa likes watching films, playing with her cats, and making art. We've got a very cat-friendly group of presenters today. And our next presenter with CTD is going to be Cole Glosser. And Cole is also a peer policy fellow at CTD with a policy focus on increasing attendant wages, as well as other Medicaid issues affecting home and community-based services. Prior to joining CTD, Cole worked for the Texas Technology Access Program, which is the state's assistive technology program, where he worked on funding options and 3D printing of assistive technology. So, Yulisa, I think you are first up.
Yes, that is correct. Thank you, Scott. I'm so glad to be here. So today, what I'm going to be talking about first and foremost are some bills that passed, and then we will also talk about some bills that did not pass and the reason why. So first up, we have school discipline. This is a major bill that went through many changes over time. By this was House Bill 6 by Representative Jeff Leach. And it's relating to school discipline in public school. And what I have here is a major component that was changed throughout session, but again, this is a huge bill. So it's mostly discussing what to do with students who have been caught vaping, caught maybe committing a non-violent offense of some kind and a violent offense of some kind. So I'm just going to go through some of the changes that happened because of HB 6. So now there's mandatory notification and the ability to respond. And what that means is that parents are now able to be notified if the child has been removed from class, suspended, or placed in DAP, expelled or transferred and they have a right to respond. They, the parents, have a right to respond or appeal to that decision. Because of that, there is more parent participation involved in this process naturally. But even before then, parents are able to participate in behavior plans where traditionally a student is sat down with their teacher, their counselor, maybe a social worker, and are able to discuss a IEP, an independent education plan. So with HB6, schools must now allow parents to actively engage in developing a behavioral improvement plan. If there's an issue that was presented that the parents then repealed. We also have a right to request in school instead of out school suspension. Again, HB6 improved the parent involvement piece in schools. So parents can formally ask for their child to be placed in an in-school suspension rather than an out-of-school suspension if they can't supervise the child with the school's discretion. And a couple of other things that were changed. Now we have the ability for schools to consent to telehealth, mental health services. Students under 18 have to have parental consent before participating in mental health services, assessment, education, or screening provided through a school telehealth program. Again, previously that did not happen. Before then, students had to go out of their way to usually a third-party clinic or hospital doctor to seek that help, but now they're able to do that in the school through telehealth. Again, parents have more participation in that they can appeal, they can be involved in the behavioral developmental plan once an issue has been presented. And additionally, parents are able to be involved and learn crisis prevention and intervention training connected to their specific child's school plan. So again, HB6 rolled out a lot of changes. And one thing in particular that we picked up on CTD was this problem of, okay, what's the difference between a first-time offender and a student who has continued issues? One particular issue that was presented over and over again was vaping. So that's why I put that there. If a student is caught as a first-time offender vaping in schools, a student can either do 10 days in school suspension or be placed in the AAP. However, there is some confusion over this because people are thinking it as either one or the other. I want to clarify that students can still get sent to DAP, but at the discretion of the school for possessing or using vaping or e-cigarettes. So there is still mandatory DAP for selling, giving, or delivering to another person an e-cigarette, vaping, or conducting anything above a Class A misdemeanor, which is getting weapons in school, physically fighting a teacher, another student, another person in the school. So I just wanted to provide that. HB6, again, main takeaway here is that it changed the way in which parents can be involved. And it upholds, I think, some transparency on the disciplinary process in which a student is funneled into. So with that, let's go ahead and move on, please, to disability history. And unfortunately, second time around, it did not pass. It did get a little farther along, though. Specifically, HB 3048 by Representative Alma Allen was specifically to teach students about President Bush's signing of the American Disabilities Act. And the Senate version of that, SB 2612 by Senator Royce West, did the same thing. And what this essentially did was it was going to update the social studies TEKS, which is the basic knowledge that a social studies teacher in a public school setting has to provide. This go around, it was filed and it was followed to the Public Ed Committee, but it did not receive a hearing. So for next go around, we hope that there will be more demand for a hearing. Again, this is simply to teach the signing of the ADA and talk about disability history and Texans and people in the United States have come before us, after us, currently, who are powerhouses in the disability community. So if you're interested in that, please reach out to us at CTD. And last, in my part, we have elections. And this is a bit of a woozy, but we got a lot of wins in this area, which I'm really happy about. So we have SB 2964 by Senator Brian Hughes, which corrects certain defects in early voting ballot voted by mail. So if you made a mistake when you voted by mail, you're able to fix it and fix that error much easier. So again, this makes it easier for voters to fix errors on returned absentee ballot envelopes. HB 2259 for Representative that, and I'm sorry, that's on me. I have dyslexia. That should say Mano de Ayala. No worries. So this provides instructions for an application from an early voting ballot and requires all early ballot applications to be provided with instructions that are available in different languages. So yay, improved accessibility. Woo. We also have another win, HB 3697 by Philip Cortez. And this is the text on an application of a ballot by mail for the font to be increased in type size. So again, more accessibility, more ways for people to get involved and know how to fill out their ballot by mail and vote. And HB 521 by Representative Ryan Guillen was one that did pass, but CTD had to work very hard to soften the original language that was part of this bill. And I'll get a little more into details on this one. So this one is about accommodating voters with disabilities in curbside voting. And it does tie in regulations on curbside voting and assistance provisions for voters with disabilities. And what that specifically means is that people who vote in curbside voting now have to complete and sign a sworn statement. If there's a person who arrives in a car and they have themselves and 6 other people, they have to sign an updated form, an oath essentially, for assisting 7+ voters for providing transportation to a curbside voting place. HB 521 also makes it, there's provisions on mandatory signage to display the contact method for voter assistance and notice of a 20-foot electioneering restriction. Polling places must reserve clearly marked parking areas as well. And the, I think, biggest change is with this bill, HB 521, is it introduces new reporting obligations for people who are working in the polls and people who are curbside voting if there's any sort of unusual activity. So the original language we were really concerned about because it seemed very harsh and criminalizing workers who were assisting curbside voters, but through working with Guillen's office, we did soften that language. And I'm also really happy to report on this component with elections. In case someone was curious here and you've been reading the news and you were curious, some really bad bills that were defeated. For example, there was a bill on ending countywide polling, which did not go through. There was a bill, many bills on submitting proof of citizenship to register to vote that also did not go through. There was also a bill on prohibiting an officer or employee of the state or of a political subdivision of the state from distributing certain voter registration application forms. That also did not go through. So I want to say in the election front, we did a lot of good and we have a lot of accessibility be improved. So anywho, with that being said, that's my part, and I'm going to go ahead and pass it to my colleague, Cole.
Awesome. Thanks so much, Lisa. Hey, y'all. I'm Cole Gloucester, and one of my main policy priorities this session, as well as a main priority for CTD throughout every legislative session for the longest time, has been looking to increase the base wage for personal care attendants. So for folks who might not be familiar, personal care attendants provide really important services, particularly such as helping folks to transfer out of bed, toileting, feeding, a lot of different things that help significantly disabled people be able to remain independent either in their own home, a family home, or even a group home. And they are oftentimes funded through HCBS waivers or other community tenant services waivers. Services. So right now, prior to the passage of SB1, which is the main budget bill for the session, the base wage for personal care tenants sat at $10.60, which is far, far too low. But a lot of CDD as well as other disability groups were looking to kind of coalesce and strengthen messaging around looking to increase the attendant wage well above that. Some groups were asking for, I believe, around $16, $15, $16. Other groups were asking for 19. And what they ultimately ended up landing on was an increase to $13 for the base wage for community attendants, which doesn't sound like a lot when you think about it, but when you look into how much it takes to fund that increase over the biennium or these next two fiscal years, it's about a little over 2 billion worth of dollars, 2 billion dollars of appropriations to help fund these increases. So in this case, it's definitely helpful to have more financial security for personal care tenants to help them remain in this industry and provide absolutely crucial care to folks who are significantly disabled and or elderly. So that one was passed. Tenant wages were passed specifically through the budget bill, but there were also other bills filed prior to session that looked to handle the attendant wages in slightly different ways individually. And those two did not pass that are on the slide, specifically HB 1721 by Representative Gervin Hawkins, which would look to establish a base wage for personal care attendants under the Community Living Assistance and Support Services waiver program. And that is a specific waiver. I believe there are around 6 or 7 HCBS waivers, but that would look to basically mandate a base wage within that specific program. And then HB 836 by Representative Leilani would similarly look to establish a minimum base wage of around, I think, $15, where I think was the case for both of them, for personal care attendants under Medicaid and other programs administered by HHSC. So again, these were kind of two bills that would have tried to kind of handle the base wage issue individually, but oftentimes what we've seen is that if there is going to be a base wage increase, which sometimes there's not from session to session, it'll be handled through the general statewide budget. And let's go ahead and move on to the next slide, please. So there are also a couple bills that CGD had the opportunity or to testify on around strategic planning for specifically HB 2807 by Representative Rose and its Senate companion SB 2896 by Senator Molly Cook. Previously, Representative Rose's bill had passed through this last session, passed through both the House and the Senate, but unfortunately got vetoed by Governor Abbott. Basically, what it would do is essentially create a statewide IDD coordinating council that would help to essentially streamline and coordinate a lot of the different entities that provide services to folks with IDD, whether that be health and human services, education, workforce, criminal justice, being able to help them more easily coalesce and collaborate when we're working towards a 5-year statewide plan. And unfortunately, that one did get a hearing, but unfortunately did not. It did get a hearing and passed to the Senate, but it died in the Senate. And similarly, that was the case with HB 2542 by Representative Stan Kitzman, which kind of similarly has an IDD specific focus, and it would like to establish a work group to study and make recommendations and services, to study and make recommendations on certain services needed by people with IDD. Next slide. Go back. Okay, thank you so much. And another priority that CD had a specific focus on this session was around several different anti-masking bills. So for folks who might be familiar, there are many people within the disability community that are still masking well beyond the pandemic because they're either chronically ill or immunocompromised. And so they need to be able to mask in public settings in order to protect their health and safety. And there's two listed on the slide here, but there are three specific anti-masking bills that we were following that would essentially look to criminalize masking in either protests or other kind of public situations where there might be increased hostility towards folks who are, the issue would be more of an increased hostility towards people who need to mask because of health issues. And there's only one bill by Senator Milton, SB 2595, which had a specific health exemption. But this was basically at the time of trial. So the issue is that this would place a lot of undue burden and stress upon folks who are chronically ill or immunocompromised needing to mask and be able to protect their health and safety in public. And thankfully, both of these bills did not pass, so it did not put it would not put as much worry or scare in those communities to maintain protecting their health and safety. And I'll pass it back over to Scott. Thanks so much.
Thank you, Cole. Appreciate it. So now we are moving on to speakers from the Texas Council for Developmental Disabilities, in addition to myself. So we have, and TCDD is a federally funded state agency whose purpose in law is to encourage policy change so that people with disabilities have opportunities to be fully included in their communities and exercise control over their own lives. So we have two additional speakers today. We've got Marissa Inacone, and Marissa is the newest member of the TCDD policy team, bringing 7 years of experience as a low-incidence special education teacher. She has her Master's of Science in Special Education, and outside of work, Marissa enjoys reading, spending time on the water, and hanging out with her wheelie cool dog, Hubcap. And also speaking today for TCDD will be Linda Logan, and Linda joined TCDD in 2014. She has a master's in public affairs from the LBJ School, and she came to Texas from the National Institutes of Health and worked as Director of Policy Development at the State Agency for Mental Health and IDD. And so let's take it to Marissa, and let me just say, we are running a little behind, so if you have any questions, please be sure to put them into that Q&A, and we'll try and answer them as we are moving, in case we don't have much time for the Q&A at the end. So, Marissa.
Thanks, Scott. So I'm going to be discussing a couple special education bills. I'm going to be starting with HB 2, which Jackie mentioned. House Bill 2 is a very comprehensive bill, but it does represent a historic investment in Texas public schools. And about $1.3 billion is dedicated specifically to strengthen special education programs. I outlined a little bit of it on the slide, but we're going to have $1,000 for initial and full special education evaluations and $55 increase to the basic allotment. Next slide is HB 568, which did change the funding model by replacing outdated placement-based approach with a new tiered service intensity model. And there was actually 8 tiers. The first tier is a speech-only tier. The second tier was for students placed in residential placements. And then tiers 3 through 8 increased levels of service intensity. So as they increase, the funding increases as well. Next slide. So we are going to be discussing a bill that passed and then a bill that unfortunately did not pass. HB 2310 directs the Texas Education Agency to develop a strategic plan to expand and improve early learning opportunities for young children with disabilities. The plan must address access, inclusion, and quality standards across early childhood programs. The bill aims to build a more coordinated statewide approach to servicing children with disabilities in their earliest years. And HB 175 by Mary Gonzalez aimed to enhance inclusion in daycare settings by requiring specialized provider training. Unfortunately, the bill did not make it across the finish line, and this was its third legislative session. It did make historic progress, though, passing the House and advancing to the Senate, but again, it ultimately ran out of time. So hopefully fifth time's a charm. Next slide, please. School safety, SB 57 by Senator Judith Zaffarini requires that students with disabilities be included in their school safety emergency planning. Amy discussed this at her college level. This is a K-12 bill, and the bill ensures that individuals' accommodations are integrated into the school safety drills, evacuations, and lockdowns. I think that was it. I tried to speed through really quick because I know we're short on time. But if you have any additional questions, please drop them in the Q&A comment and I will address them.
Thanks, Marissa. And just a clarification, the bill from Senator Betancourt was SB 568, not HB 568, just for everybody. All right, Linda Logan, take it away.
Okie dokie. I think most of you are pretty familiar with the programs that I'm going to talk about. First of all, guardianship, Senate Bill 746 by Senator Zaffarini and Synchronia Thompson authorizes a judge to sort of step in and appoint a guardian ad litem where there's a situation in which somebody has an adverse interest in the person for whom guardianship is being sought. The bill prohibits a person with that kind of adverse interest from filing an application for the appointment of a guardian or filing a motion or complaint to get rid of a guardian. So this felt to me like it probably spoke to some specific circumstances that may be repetitive, and it kind of fills a gap in protection for people who are seeking guardianship. The next, thanks. House Bill 3376 by Representative Capriglione and Senator Zaffarini requires training for the guardian of a person or the estate or a ward who is 60 years of age or older, or is younger than 60, but has been diagnosed with Alzheimer's, dementia, or a related disorder. The guardian of such a ward or person needs to now take a 1-hour training within 6 months after appointment and then annually thereafter. And the bill goes into some detail describing what needs to be in that training. And it sounded like it made good sense to me. Also, probate court is required to ensure a guardian's timely completion of training unless the court waives it. And the training must be available and completed not later than September 1st, 2026. It was signed by the governor. It's effective 9/1/2025. Next slide, please. Good, thank you. Supported decision-making. Texas became the first state in the nation to offer supported decision-making in statute with the passage of Senate Bill 1881 in 2015 by Senator Zaffarini. Since then, nearly 24 states, and I tried to get a real crisp number, but I couldn't find one, have also enacted a legal framework recognizing SDMAs. Research shows when adults with disabilities can exercise greater self-determination, they have improved employment and community participation, and are better able to resist and avoid abuse. Did I not? Well, that's okay. I mean, I'm fine if my video's gone. Okay. And beginning in 2021, Senator Zaffarini began seeking to enable supporters, to go with the person they were supporting to court proceedings. And it's taken all this time, but it has passed. And probably one of the reasons it passed was she wisely couched it in conducting a study on the legal and ethical implications of authorizing a supporter through an SDMA to assist an adult with a disability in legal proceedings. So, to quote Senator Zaffarini, everyone deserves access to meaningful support when making important decisions, especially in court. It was signed by the governor, takes effect 9/1 of this year. Next slide, please. Clinical research. Okay, this was a really fascinating one. It passed. And it's the Dementia Prevention and Research Institute of Texas, DPRIT. And Cole, you made me feel a little better because when I saw the fiscal note on this, $3 billion, and then compared that to how little, attendants in the community get paid, it kind of hurt. But as you pointed out, I didn't really realize that the really modest raise in salary for them is going to amount to $2 billion. Is it a year or a session? I don't know. Anyway, this program that is being proposed to highlight better research, prevention, and treatment strategies for dementia, Alzheimer's disease, Parkinson's disease, and related disorders. It's going to be voted on November 4th of this year. And the fiscal note will be given to the populace to decide whether they think that's a good use of funds. I think probably it is. Also, it's important to note that the bill caps the amount the legislature may appropriate from this fund for a state fiscal year to $300 million. So, and anybody applying for the money has to have at least half of what they're asking for in unexpended funds. Next, compassionate youth program. This is a bill that's actually a program that came into being because a member of our council was seeking relief for a family member who had intractable epilepsy that was life-threatening. And because of her passionate advocacy, the bill went through, and now every session, small changes are made to, make it better. And in this particular session, they defined and described phytocannabinoid, which is the only type of low THC cannabis permitted. It's plant-based and not in any way chemically synthesized. It adds to the list of treatable conditions: traumatic brain injury, Crohn's disease, and a terminal illness or condition for which the patient is receiving hospice or palliative care, and chronic pain, which it defines. Now they're enabling a physician to submit to the Department of State Health Services a request for other uses, provided they can show medical evidence such as peer-reviewed research. And for the first time, it allows for the administration of low THC cannabis by pulmonary inhalation if the physician determines that this is a medical necessity. And just a little note for those of you that watch rules, the bill requires rulemaking on the use of the pulmonary inhaler. And then I'm going to, it's 212. I'm going to just, yes, there are a list of bills with an emphasis on mental health and substance abuse, and I'm not going to go through those right now. I would like to point out to you, though, House Bill 500 by Representative Bond, and I'd like to point it out to you because if you ever wonder what's going on in the state, and what are they building? Where are they building it? And House Bill 500 is just a treasure trove of initiatives and things that are halfway finished, like the El Paso State Hospital, which is also known as the El Paso Psychiatric Center, and other things like a grant for an inpatient mental health facility, with emphasis in a lot of these on at least 50% forensic capacity. So it's kind of trying to take it down to the local level. Anyway, I would suggest that you would find other things that are very interesting in Senate bill, House Bill 500.
All right.
And that's it for me. And thank you for allowing me to, talk with
All
you.
right. Thank you, Linda. I am going to move it along. What I did want to do is shift our conversation before we move to the Q&A, have a quick conversation on private school vouchers or education savings accounts, because it is a topic that most of the organizations on this call, if not all of the organizations on this call, worked on. So let's just quickly talk about that. And I know it was something that many people were interested in. So Marissa, if you want to give a quick overview of what's on the slide, and then I'll turn it over to Jackie Benestante or Brooke, or if anybody else wants to throw anything else in.
Yeah, thank you, Scott. So there was a couple different funding tiers in SB2. I know a lot of people heard about the $30,000. So that is for a child with a disability, they can receive up to $30,000 if they choose to go to a private school, $8,000 for a neurotypical student, and then $2,000 for students who are homeschooled. It does prioritize students with disabilities, students from low socioeconomic households, and students from low performing schools. And it is open to all Texas age children, even students who are already in private schools. But again, it prioritizes students from low income households, students with disabilities, and those attending underperforming schools.
Awesome. Jackie or anyone else, would you like to add something else to the voucher conversation?
Sure, I can just say we worked on this for years, opposing it. We had a lot of concerns about, like many of the disability organizations, loss of your educational rights, no IEPs, no 504s needing to be honored. We've seen a lot of discrimination, private schools not wanting to take kids with autism, and of course, huge areas of Texas that don't have any private schools at all. And so, definitely very concerned about how this will play out, as well as the burden on public schools to evaluate the students with disabilities to see how much of the 30,000, because it's up to 30,000, how much they're going to get. So I think it's going to be like a challenge, like a burdensome implementation, and we'll see how it plays out for students with disabilities. But I still have a lot of concerns here.
And this is set to go into effect for the next school year. So what is that 26, 27?
Yeah, fall 26. So the state's got like a year to ramp this up, but I think this is going to be quite a lot of administrative burden on public schools and the state itself.
Excellent. Anyone else? Yeah, sorry.
We do have the $1,000. Obviously, we know that that's definitely not enough, but that is a great boost, because we do expect to see an increase in families getting evaluated for special education services to then go to take that funds to the private schools. So we do expect that, and so hopefully that $1,000 will help cover that.
Elisa, I saw you jump on camera. Did you want to add something?
Yes. Yeah, I did. Thank you. Returning to Jackie's point, our concern was also that students with disabilities would be kicked out with no really alternative to their educational career. And we do want to emphasize that when we did our research, we found that a majority of schools with the school choice voucher program did not meet IDEA compliance B for 2 or more consecutive years. So, to us, it looks like even if parents push back, it doesn't really get anywhere. So that's our main concern with vouchers as well.
And I will add that so there were a number of amendments that were offered to this bill to try and address some of the concerns of the disability community, trying to make sure that schools, private schools participating in this program had to honor the IEPs of students that were moving in. Other areas, those were all rejected for the most part. There was some additional reporting and a few other measures that were added into the final version of the bill. And if anybody has any questions about that, we can certainly, stay in touch and provide that information at a later time. So with that, I would like to, so I was going to talk quickly about TCDD resources and just mention that we've got a bunch of resources that are on our TCDD website, so you should check them out and see if they can provide you some information. I know that all the groups on this page have various resources on their websites, so please check them out. I do want to mention that now that we're out of the legislative session, obviously, the Texas Legislature only meets in regular session once every 2 years for 140 days. So the next legislative session isn't scheduled to begin until January of 2027. Which will be here sooner than you think. But in the meantime, the governor has already announced that there will be a special session. He has put together a list of some items that he vetoed or kind of let pass into law without his signature that he wants additional tweaks on, that he has asked lawmakers to come back and address. As of yet, there aren't any really disability specific issues that are on that list for the special session coming up. However, the governor can always add additional items to the special session agenda as he wants to, or can call additional special sessions in the future. Additionally, lawmakers can always take what is on the call and what has been filed and then kind of amend it, that put an amendment on there that might more directly impact the disability community. So I know that TCDD and all the groups on this call will be paying attention to what's going on in the special session. And we'll be providing updates as necessary. I also want to mention that once we move out of the special session, interim committee hearings will start up, and lawmakers will spend the interim looking at kind of what they did this past session, looking at the implementation of some of those measures, but then also planning for the upcoming session and maybe doing a deeper dive on some issues that they expect to come up in the session that starts in 2027. So be paying attention to that. I'll also say, related to those interim hearings, the speaker and the lieutenant governor will both be announcing sets of interim charges for the committees to be looking at in the Senate and the House over the course of the interim. So those interim charges don't usually come out until anywhere between November and February, depending on how things are moving. So we will also be paying attention to that and providing information to everybody where necessary. So moving on to the Q&A, I know that we had one question to start off with regarding a bill that would have created a rare disease advisory council, and that was House Bill 3554 by Representative Lauren Ashley Simmons. And this is a bill that would have created an entity to kind of look at rare diseases, and which was defined in the bill as a condition that impacts fewer than 200,000 people in the United States. So it would have helped provide information, looked at different ways to address it, provide more detail to lawmakers, and help with that. That is a bill that passed out of the House, but unfortunately was not referred in the Senate. There was a Senate companion to the bill, Senate Bill 1140 by Senator Boris Miles, and that was referred to a committee, the Senate Health and Human Services Committee, but it did not receive a hearing. So this is something that, we'll be talking about over the course of the interim and maybe seeing if another bill can be introduced in the next session or what more can be done. I know there were some questions about, there was a question about eliminating the acre, only resulting in 24 cents for community first choice. Linda Litzinger, I know that you're typing an answer. Did you want to answer that live or just type the answer in the chat? And you're on mute, Linda. I'm sorry.
I thought I was answering the Henley Act question. Sorry.
Oh, okay. Okay. Sorry. Well, I think this was I think this one that I saw you typing an answer to was just kind of a comment about how the $13 base wage does not in any way cover the necessity, and that is a concern that was had by most groups throughout the session. So
Absolutely. Yeah, it's very frustrating. We desperately wanted a higher base wage, and it's one of those things where we're slowly digging out of a hole. I mean, a fun fact, but not so fun fact, is that basically from 2009 to 2023, basically there's only an increase in the base wage of like less than $1 from like 7.25 from the federal minimum wage in 2009 to $8.11 in 2020, 2019, I believe. And then starting in 2023, and now in the session, we've gotten an increase of over $2, like both times, but it's still a very big hole for us to climb out of, and I know that it's really not sustainable still for many personal care tenants for sure.
all right. Anything else on the attendant wage issue that somebody wants to add? Okay. I am answering a question about legislative interim committees, typing that up. There was a question, can we talk through why it seems that little to no IDD waiver interest list slots are being funded in the next biennium? Somebody want to tackle that?
This is Linda Litzinger. I truly think that they're pretty freaked out about what's going on in Washington, and they're going to take so much money out of Medicaid that the optional programs, which are the waivers, are pretty scary right now. And so I think that's why they didn't do it. Anybody else?
Linda, you're probably right, but it just seems like systemic underfunding of disability,
Yeah.
like programs and services for people with disabilities across the board. I feel like every single program, I mean, at least school funding improved, but so many things just didn't improve, stayed flat, or they didn't get
Yes.
worse, but we're not improving. It's just not, it hasn't been a priority, I don't think, unfortunately.
Yeah,
Go ahead.
in some ways, I was going to say from a legislative standpoint, like they've kicked the can down the road for so long that now it probably just feels daunting. Like they're probably just completely overwhelmed with, just how far they've pushed this out, but they really got to figure it out so that we can start getting some slots funded in a considerable way.
Yes. And also once you get it and then you find out it doesn't pay enough to get an attendant, especially class is way lower than some of the others. And so you go without any attendance. And most legislators in our capital, they tend to forget, even if they ever heard it, that it's Medicaid fraud to pay under the table, to make it be a living wage or even equal to a McDonald's wage.
Um, Linda, while we're talking, since you brought up the federal stuff, do you want to mention anything about the what's being considered at the federal level
Sure.
in terms of
Yes.
Medicaid or anything like that?
Um, and the vote may be as early as this Friday. The bill is called HR1 if you want to talk about it officially, and it's been through the House and now it's in the Senate. And the Senate actually made it worse in some cases.
Ugh.
But there's just not a good thing about this bill. It's not fixable. And so the bottom line is we all need to call our two senators, and they're Cornyn and Cruz, and just say, please vote against it. It's bad for different states for different reasons. We're not in a Medicaid expansion state. They're going to have Medicaid checks twice a year instead of once a year. Um, it's it's bad for Texas more than many other states because it's there's some tax situations that go on that give the providers money, and these tax situations are going to go away, and it's going to be closing 300 hospitals in the United States, and a good many of them are rural Texas hospitals. So Texas will be affected the worst. And so we're going to have people that fail Medicaid. We're going to have people that have a work requirement. And it used to be in the work requirement that you just had to prove that you had a job anytime in the last 3 months. And the House bill changed it to in the last month, and the Senate bill changed it to you have to have a job right now in order to apply for Medicaid, for the work requirement. Thank you. I can tell you a lot more, but I would talk for an hour. So just email me or something if you want to know more.
Thank you, Linda.
Uh-huh.
And it's my understanding that for that bill, is this the one that they have to vote on it by the 4th of July, or else it is not applicable? They have to like restart the process, or is that a different bill?
They
I
don't
don't
have to
think
restart the process, but the president has threatened them that they can't go home for the 4th unless they do it. And they're trying to do it by this Friday. But more to be more to be told if we get to Friday and they haven't done it. And then it has to go back to the House to resolve the differences. At that point, you'll be talking to your own congressman.
Yeah.
And
Yeah.
I will say, something that we've heard from different Medicaid advocacy groups is that, especially for folks who are living in more rural districts of the state, because rural hospitals have the might be disproportionately negatively impacted because of potential loss of Medicaid funding, and that loss of Medicaid funding also just affects every resident who's trying to access those rural hospitals. But also, there might be a couple of not sure if I'm allowed to say representatives in the Valley area in Greater San Antonio who like Republicans who have shown concern, at least in the past, and being able to continually kind of bring about those concerns around Medicaid or the ACA is really vital.
Also, the House started with any child age 8 and above could be home alone. And so you imagine a single mom leaving a kid home alone for the summer at that age. Then the House changed it to age 14. No, the House changed it to age 18 and the Senate changed it to age 14. So then you're going to have to prove that your child has a disability, and that could be difficult for some of the hidden disabilities. So that's in there too.
All right. Well, we're at 2:31, so we're a minute over our time. I do just want to note there was a question, really more of a comment from former TCDD council member Laura Taylor, who mentions that the bill that is on the special session call relating to the hemp industry does have the potential of impacting the disability community. So we are going to be paying attention to that.
Yes.
and it could go in a lot of different directions. So we will be watching out for that and providing info. Um, with that, I want to thank everyone for participating, for attending, for listening. I will be sending out a link to the recording and to the slideshow. And then if we have a second, I believe that there is a survey that we wanted attendees to quickly take just a couple of questions, which just showed up. Um, if you want to answer that before you log off. Otherwise, please don't hesitate to reach out to TCDD if you have any additional questions or to any of the other great organizations that were on this call. And I do want to say that we had a lot of representation on this call, but there are still a number of other disability organizations that we work with all the time that are very active, the Arc of Texas, Disability Rights Texas, and others. So shout out to them, and we all kind of bounce things off of each other and help each other out and are here to serve you all. So thank you very much for participating. Have a good day, and yeah, go to the TCDD website for additional resources. Have a good one.
Thanks, Scott.
Hey, thank you, Ginger. Appreciate it.
Good job,
Thank
Scott.
you so much. Enjoyed it.
Thanks, Brooke.
Bye.
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 All right.
I think we've got everybody that is on, has done the poll. So we had
Okay.
61 people complete it.
Okay.
So
Great.
all right. I'm
Well,
going to-
let's shut it down and we get a copy of this.
What's that?
And we get a copy of that survey, or we can access the results for the survey.
Yeah, I have them, and I can send those to whoever needs them.
Okay. All right. Well, thanks, y'all.
All right. Thank
Have a
you.
good one.
Good job. All right.
All right.
A total, I think that the highest we had like 182 people.
Okay.
So,
That's great.
yep. Cool.
All right.
All
Take
right,
care.
I'm
Thank
in.
you.
Bye.
Bye.